Let's learn the ABCDE of skin cancer. When do you suspect that a mole that you have is now turning cancerous? Dermatologists have come up with a simple acronym known as the A, B, C, D and E of skin cancer. A stands for asymmetry. If a mole that was perfectly round or oval is now becoming asymmetrical, that's generally considered a bad sign. B stands for borders. If your mole is becoming irregular in the borders, if there are areas that are creeping or growing outwards, that's a bad sign. C stands for color. If your mole is uniformly brown or black, that is normal. But if your brown mole is showing areas or clumps of black clusters, that's a bad sign. D stands for diameter. Any mole that is greater than 6 millimeters in size is usually required to be monitored regularly. E stands for evolution. So if your mole is growing in size, if it is turning itchy, ulcerated or bleeding, those are bad signs. If you have any of these signs, you will need to consult a dermatologist who will either examine your mole with a special lens called a dermatoscope, or who will take a skin biopsy, take a piece of the mole and send it to the lab for testing to rule out skin cancer. Skin cancer is not just about sun exposure. Genetics also play a role. For instance, melanoma typically occurs either on the thigh or the back or on the soles of your feet, which rarely see any sun.